Hey, it's Dr. Jessie, your Chiro Yogi. Today I'm going to show you the difference between internal rotation of the hip and external rotation of the hip. We'll go over the muscles that control those actions in the body, and then you'll also have the opportunity to identify whether or not you're seeing internal rotation or external rotation in several yoga poses. So first we'll talk about external rotation of the hip. It is performed by the external rotator muscles of the hip. So namely your glutes, you have your gluteus maximus, minimus, medius, and your piriformis muscle all assist in rotating the hip back. So as a simple exercise, you can stand on your left leg, pick up your right leg, and then just squeeze your glutes. And you'll notice that just by squeezing them, it causes my foot to move out to the side because my hip is being pulled externally. So you can try it on both sides. You're not even really trying to externally rotate your hip at this point, but just by squeezing those muscles, you'll get the idea that they cause the hips to move out, to externally rotate. Now, the internal rotators of the hip are your inner thigh muscles and also part of your hip flexor. So these muscles pull the hip inward. So you can do the same exercise, just shift your weight over to the left leg, pick your right leg up, and then just start to internally rotate your leg. Now with this one, you're actually gonna have to try to pull the leg inward because these muscles aren't quite as strong as your glutes. But still, you'll feel that muscle contract when you pull the hip in. So rotating the hip inward, internal rotation, and then externally rotate. The hip is rotating outward. Okay, so we'll move down to the floor and I'll show you where some people can get confused about internal and external rotation in certain situations. So first, with my legs straight, just as we showed before, this is internal rotation of my hips. This is external rotation. I know that it's harder to see here, but I'm squeezing my glutes and causing the hip to rotate externally. Now we'll throw a little monkey wrench into it. So I'm just gonna bend my knee. As I bring my leg across, my foot comes inward, but my hip is actually rotating outward. So this is external rotation of the hip. The hip is rotating outward and it's bringing the foot across the body. I think the confusion comes into place because the foot is moving inward. So it makes you think that that's internal rotation, but it's not. So this is external. And internal rotation is when the foot comes out. So my hip is rotating inward towards my body. So again, one more time, this is internal rotation with my foot going out, and this would be external hip rotation. So this is how most physicians would examine your hip to see how your internal and external rotation fares on both sides. So go ahead and test it out on your own. See which side is maybe tighter in your hip. Now let's have a little fun. We're going to go through several yoga poses. As I will hold the posture for a little bit of time, giving you the opportunity to guess whether or not the hip is internally rotated or externally rotated. And then the answer will come across the screen. Okay, let's get started. Okay, our first posture, Prasarita Padottanasana. Feet are wider than hip width apart, 3 or 4 feet. The outside of your feet are parallel to the mat. Hands on the hips, lift the chest, inhale, lengthen through the spine. And exhale, start to fold the body forward. So here's your time to guess. What position are the hips in? Internally rotating or externally? Okay, here we go. Second posture, figure 4 or a modified version of tree pose. Shift your weight over to the left leg, pick the right leg up, hands together at the heart center and press the hips back. Okay, here's a real challenge for you. You have to guess what the right hip is doing and what the left hip is doing. Okay, and we're just gonna take a warrior 3 position, modified so that you can pay attention to the hips. Hands on the hips, right leg steps forward, left leg steps back. Lift the chest up as you inhale. And exhale, start to fold the body down as you keep the hips level. So most instructors are going to tell you in order to keep the hips level, you have to pull the right hip back and then lift from the inner thigh of the left leg. So those are your only clues. I want you to think about what is the right hip doing and what is the left hip doing. And for your reference, my left leg is the one that's in the air. Okay, so I hope you had a little fun and learned something about internal and external rotation of the hip. Feel free to email me with any questions that you have about the answers, or also if there's a posture that you're not sure about, if it's internal or external rotation of the hip, and I'd be happy to explain it to you. See you soon.